Hi, Alice, and thank you for joining us on the Once Upon a Binge podcast today. I'm really looking forward to having a chat with you today.
Thanks, Becca. Thanks very much for inviting me.
You support people a lot with kind of body changes, don't you, as they go through illnesses or changes in their life that can affect their body. So can you tell us a little bit more about that work that you do in a wider sense?
Yeah, absolutely. So I'm a registered dietitian. That's what I work as. But my main interests in that are I practice in a health at every size paradigm, which basically means that when I'm talking to patients and when I'm trying to provide them with dietary interventions, I'm always trying to treat the person, treat any kind of underlying illness, treat any symptoms that they're having, but not trying to use weight as a surrogate measure for health. Because a lot of the time in nutrition and often in dietetics, we really focus on weight as our metric of health. And I don't think that weight is a very good metric of health. I think that we could focus on much more important things like quality of life, like ability to move well, like blood sugars, like blood pressure, things like that are actually really clinically relevant to the person. And so you were saying as well that I work a lot with people who have been so quite a lot of my clinical practice involves working with individuals with cancer. And one of the things that I do a lot is particularly helping young women who have had cancer basically come to terms with what has changed about their body and what has changed about their eating patterns and help them move forward with that and meet really meaningful health goals for them. So things like reducing their risk of cancer recurrence, things like reducing their risk of osteoporosis after having hormone treatments, things like that. And basically trying to optimize their health and their quality of life, whilst also helping them to re-engage with food, trust food again, trust their bodies again, and trust their hunger signals again.
Thank you for sharing that. So it sounds like for you, the health at every size kind of paradigm that you work within, the way this intersects with people who've gone through big, significant body changes is around the shift away from weight. So is that right? Would you say that people who have gone through these big body changes, one of the issues that they struggle with the most is the change in weight, and that this kind of paradigm coming in and moving away from that as a focus is helpful? Is that is a fair summary of how you work?
Yeah, so I think if we're using the example of people who are recovering from cancer, quite a lot of the cohort that I see are people who are recovering from breast cancer. And as part of breast cancer treatment, you usually end up having hormone treatment. You usually end up going through a premature menopause, and that can have a really significant impact on your body composition. Often people really gain a very significant amount of weight, and that can be really difficult to deal with because not only have you been through this major trauma, but your body looks completely different to how it did before. And not even to mention things like having mastectomies and other surgeries as well that further change your body image. So yeah, absolutely. And I think that sometimes when you have gained a lot of weight, when you've been unwell, you think that actually in order to be normal and in order to be healthy again, you need to lose that weight. And unfortunately, particularly for patients who are still going to be on long-term hormone treatment and who have gone through the menopause, a lot of these changes they're going to be really permanent because you've had a lot of metabolic changes in your body. And trying to help people get to grips with the fact that they can be really healthy, they can be really active, they can reduce their risk of cancer recurrence, and all of that can happen in a bigger body to what they started out in.
Yeah. There's parallels here, isn't there, with eating disorder recovery? And I'm thinking about my experiences with that in terms of going through eating disorder recovery and gaining weight as part of that and having to create it's a real paradigm shift, isn't it? To go from I have to look a certain way, be a certain way, to be desirable, to be healthy, to fit all of that. And that was all challenged for me as I went through recovery and did gain weight. But what I was thinking about as you were speaking there is as hard as that can be through an eating disorder recovery, there can be some level of like preparation for that. And in the sense of, I did a lot of work on covering and challenging certain beliefs before I got to the point where I really let myself kind of take that leap and let go of things. Whereas what you're talking about here with people who get ill or they get cancer or they go through the menopause, there's an element of unpredictability to that I imagine that just appears to someone in their life, and there's not the period of time to mentally prepare for that. And I wonder if how that impacts people, or in terms of making it more challenging in some ways. Do you know what I mean?
Yeah, no, I absolutely know what you mean. And I think it's something that is also not really well known about a lot of cancer treatments. I think a lot of people associate cancer treatment with losing weight and becoming really skinny and having that cancer look. So when you've come out the other side of cancer, you've actually gained 2 or 3 stone. It can be really shocking. It can be really surprising. And often people who have like you say, underlying beliefs about what it means to be thin, that can be a huge challenge, because in our society we attach such a huge amount of morality to being a certain way. You're a good, successful person, your body looks a certain way, and you have failed in some ways, your body looks really different to that. And people also attach that, I suppose, can get really anxious about gaining weight and about other people's perception of them, that they're no longer a healthy person, they're no longer a successful person. And I don't think you really get any warning to that, because when you get cancer, unfortunately, you go and see the oncologist and then you just crack on with whatever treatment they give you, really. And you're exactly right, that there is absolutely no time to process how your body's going to change, and there is no time to start that healing process. And I think, again, that's a really important part of what I do, is trying to help people to come to terms with those changes.
Yeah. And obviously for my listeners, I would imagine the majority of them are not in the situation that you're talking about, where they're ill or they've got cancer and that's why their body's changed. I imagine more body changes are to do with things like the menopause. When I look at my demographics, I do have quite a lot of listeners who are in their 40s and maybe starting to go through that process, right? So some of this might be quite relevant for people who are at that point in their life and have their hormones are changing, their bodies are changing as a result of that. So like you've touched on a little bit actually about the challenges that people face with this. And would you say that in your experience, that it is from a physical point of view, in terms of the physicalities of how someone's changed and how that impacts them? Or would you say it's more from an aesthetic point of view? Because I'm thinking about this for myself in terms of gaining weight and in recovery stuff. There was one aspect of it which was very much about, okay, my body looks different now. How is it? What does that mean about me? What do other people think about me because of how my body's changed? But there was also an element of, actually, it feels weird to be in a different size body. It physically feels weird to do this, to do that. I'm not familiar with how my body feels when I do that. And that was also quite difficult. So do you see both of them, or is one more than the other? Or do you have anything to kind of say about that?
Yeah, I think you get that in really equal proportions almost. There's a huge amount of worry about the real practicalities of, like, how will this change in my body impact my health? How will this change in my body impact the way that I can do things? But also, like we were talking about, very much that what will people think of me because of it, and how will I think of myself because of it? And I think it's really interesting that you were drawing a parallel between cancer recovery and menopause, because there's so much crossover in that sphere, again, because it's all about hormonal changes. And a lot of the things that I see in both cohorts is that there is an expectation that your body is not going to change. Your body is not going to change significantly through cancer treatment. Your body is not going to change significantly through menopause if you're able to do it right. And I deal with this a lot, and I spend a lot of time explaining to people how it's really natural after a big life event for your body shape to change and your body composition to change. And likewise, it's so normal as a human being going from your childhood adolescent body into your adult woman body, into your perimenopause body and beyond. And I think there's a lot of expectation of, I'm 50 now or whatever, but I didn't look like this when I was 30. And of course, you're not going to look the same as when you're 30. Of course, your body's not going to be the same shape and tone and whatever as when you were 30. But there's such an expectation that if you do things right and if you follow the perfect diet, that is what's going to be the end result. And it's just not true.
Yeah. I'm nodding a lot because I relate to a lot of what you're saying here. The idea that, and I think particularly for women, right, there's this idea once you turn 18 and you're an adult, that's your adult body, and your adult body should stay the same. Changes before that are a bit more acceptable because you're going through puberty. But actually it's really bizarre because especially as women, our bodies do change so much and they're much more driven by hormones, aren't they? Fluctuations in that. And even as you were talking, I was thinking about messaging that we have in culture around women who go through pregnancy and then afterwards that their body should return to a certain way after pregnancy. It shouldn't really look like you've been pregnant and had a child. It's an immense amount of pressure to put on people, and in particular, women. How do you approach this with clients then? What's your way of working through these body changes where hormones are massively evolved and helping people kind of make sense of that and come to a place of acceptance with that?
Yeah, so I suppose one of the really nice things about being a dietitian is the way that we're trained is a two-tier approach. So we have our really scientific training, our training about how to interpret nutrition research, how to make that accessible to people. But then we've also got our kind of empathy, person-centered kind of psychological training as well. And I think it's so important to bring that in from both sides when you're talking to people about this. So I love talking about the natural process of aging, the natural process of healing from illness, the natural processes of body change, and delving into the different aspects of that and the different hormonal changes and kind of what is expected as part of those normal physiological processes. But then as I go through that with people, I tend to pick out the things that really cause them a lot of anxiety and the things that, even though they're hearing what I'm saying about the kind of the science and the research and all of those kind of things, that still just don't really compute in their brain because we've been so heavily influenced to think in certain ways, haven't we? And I use quite a cognitive behavioral approach to then address some of those specific anxieties. So I'm calling them anxieties because I use a really similar model to what you do when you are tackling anxiety in cognitive behavioral therapy. I essentially go through those anxieties and then encourage people to do like a gradual introduction of them and a gradual facing up to those things that make them feel really deeply uncomfortable, and doing that in a really structured way that hopefully makes it feel manageable and makes it feel achievable. And I suppose the aim also with those things, like with any kind of cognitive behavioral therapy, isn't to get rid of those thoughts, isn't to fix this, because you can't change fundamentally the way that people think about themselves. But it's finding ways to manage that so that they can live a really healthy, really functional life.
It's really interesting to hear you talk about the two-tiered approach because for a long time, I actually would say before I really started doing podcasting and connecting with other professionals who worked in like eating disorders / disordered eating fields, I had an idea of a dietitian or a nutritionist. It's very food focused. So it's more the scientific, the nutritional content, food focused side of the work that you do. And the more I've spoken to people, I've realized that actually dietitians and nutritionists do a lot more in terms of the beliefs around food too. And I find this really interesting in the sense of where do you see the dietitian's role and where does that end? And then where does a therapist's role come in and where does that start? The distinction between the too, because it feels like there's a middle area where it gets a bit murky and both roles doing a little bit of each other's. What do you think?
I think it's honestly where that individual practitioner feels comfortable in going at it. And for me, I feel really comfortable delving into feelings and anxieties and delving into kind of that basic cognitive behavioral therapy. But equally, if I felt that somebody had significantly risky behaviors around their mental health, around their attitude to food, if they were showing very significant disordered eating, then I would absolutely have no qualms about escalating that to either a doctor or a psychiatrist or somebody who is appropriately trained to take that to the next level.
Yeah. Yeah. It feels like there could be also I think the two work really well together. If you were to have a dietitian who is focusing on food and challenging some of those beliefs in almost a more, like you say, a CBT way, which is focusing on the cognitive side of things, maybe, and challenging those beliefs and those cognitions, and maybe you're slightly more focused on symptoms, that could work really well with a therapist or a counselor where you are delving more into existential identity kind of work, the root cause, really deep stuff. I can see how they would work really well together, but I imagine that's a luxury to get both of them, to be honest. A lot of people are not in that position where they have both kinds of support at the same time.
Yeah, to be fair, I'm really lucky in one of the roles that I work as a dietitian is in an intensive care setting. And we also have an amazing clinical psychologist there. And it is really nice in that rehab phase of illness after being very unwell, critically unwell, to have not only the dietetic input, the physio input to get you physically stronger, but also that clinical psychology input to really rebuild people mentally afterwards as well.
Yeah. It would be wonderful if we could offer that all the time.
I know, wouldn't it?
Yeah. So when in your work, do you notice anything that's quite common okay, these are particularly common triggers for people as they're going through a big body change? Yeah. Is there any commonalities of what triggers people or what comes up?
So, yes, I think probably two major themes with regards to gaining weight, accepting gaining weight and accepting the fact that you're going to be living in a bigger body. The two main things that come up with people from a health perspective, people are really worried that living at a higher BMI is going to have a really significant impact on their overall health and that side of things. And then the second one, again, is very much about failure as a person if you have failed to maintain the correct body image, and that kind of acceptance that this is not something that is within your control and this is not a moral issue. Those are probably the two biggest things that come up in my work.
That comes back to what you were saying about that I should be able to go through this or my body change. So you should be able to go through menopause or go through cancer treatment without your body changing. And I can relate to this, and I'm sure listeners will be able to relate to this idea. I should be able to recover from an eating disorder and my body won't change. And if I could recover and challenge all of these food beliefs and eat a certain way, but my body not changed, then I can accept it. Then that's okay. But actually, I think part of recovery is being like, I have to accept that challenging all of these things and working on these beliefs and my identity and the shame, all of that, you have to take a leap. Actually, I need to trust that process, and my body might change and I don't know how it's going to change, and I have to trust that. Whereas I think the fear of weight gain can be one of the final things that stops someone in taking that leap forward in their recovery, the fear of it, because it's such a huge fear for a lot of people, like you say, because of how they're going to be received in society, what it means about them and health. So I think that this is a good place really to speak about health at every size and your kind of approach to that. What does that mean for you? Because there's a lot of misconceptions around health at every size, I think, out there, like there is around intuitive eating too. So I'll hand over for you to say, what does health at every size mean for you?
So I think probably some of the first things to say about health at every size is that in this country, particularly, our government, our medical services a lot of things have a very strong message that says if you are overweight, in inverted commas, if you have a BMI over 25, you are unhealthy and you are putting yourself at risk of diseases and you are becoming a drain on the healthcare system, essentially. Well, I just really want to debunk that. I really want to say that people come in a huge variety of shapes and sizes. A lot of what your body composition is going to be, what you're going to look like, is very heavily based on your genetics, very heavily based on things like race and ethnicity. It's very heavily based on kind of traits from your far off ancestors of what they needed for survival at that point in time. And we use BMI as this kind of panacea of determining whether you are healthy or not healthy. And actually, it's such a flawed measure, best a very surrogate measure of health. That is not, there is absolutely no way to tell how long you're going to live and what diseases you're likely to get just by looking at your weight on the scale and how tall you are. That's just not really a thing. And actually,
it was never really created for that purpose, was it? Anyway, from my understanding, I've spoken briefly about this in the podcast before. It was never actually created as a measure of health. It was based on white males for starters, as just a general kind of statistical understanding of what the average person is like. It wasn't to do with health, but it's become about health. And again, like, I fall in the overweight category based on my BMI. But actually, before the 90s, I wouldn't have fallen in the overweight category because it was, I can't remember what it was, 1991 or something like that, around in some point in the 90s. They just randomly changed the categories, didn't they, for insurance purposes. So everyone suddenly became overweight when they weren't. And I'm like, it's so arbitrary. It blows my mind. But that something so arbitrary and not created for the purpose it's being used today holds so much significance in the medical field and for a lot of people as well. Sorry, I interrupted there, but I just felt like I needed to say that.
No, you're exactly right. And I think, and actually we know from massive data studies that people who are in the overweight category of BMI actually live the longest. So yeah, congrats. Yeah. So I'm so passionate about making sure that your dietary interventions are actually going to be meaningful to your health and actually going to be meaningful to what you have got going on. I don't want to look at surrogate measures. I don't want to look at things that might correlate with different diseases. I want to look at things like your family history, what your actual risk of these diseases are, what your blood sugars are looking like, what your blood pressure is looking like, really tangible measures, and base my interventions for you on those measures rather than arbitrarily trying to move your weight on a scale. We also know from lots and lots of research that individuals who lose weight, around 95% of those people will have regained it within 5 years. So regardless of whether it's going to kind of change things health-wise or not, it's just not attainable. People cannot do it.
Yeah, and actually, doesn't the research show, I know you're quite keen on research and debunking myths and stuff with research, doesn't the research show that actually weight cycling, so that losing weight, regaining is actually more harmful for your health than ever just existing in a larger body as it is?
Yeah, absolutely. From both a physical and a psychological perspective, weight cycling is very harmful for you. And again, I think a really huge role of what healthcare professionals should be doing is reducing harm to people. And if there are interventions that carry risk of harm, I don't really feel comfortable doing that. Yeah. So that's the background to health at every size. Like I say, is instead of focusing on that really weight-centered paradigm and thinking that changing your weight is going to really change your health conditions, I focus on changing your diet in specific ways so that you can change those specific measures of health. And then I also build into that some intuitive eating. So again, intuitive eating, there's a lot of worry and myth around it. So a lot of people think of intuitive eating as basically just binging on rubbish all the time with no restrictions and being really unhealthy, which couldn't be further from the truth. So intuitive eating to me is about learning to tap into your body's signals, not only about when you're hungry and when you're full, but also about thinking about what your body is craving in that moment and listening to what your body is craving and thinking about why that might be. Are you craving carbohydrates because you didn't actually eat that much the day before, or because you've done a lot of exercise, or for whatever reason? Or is your body craving kind of sugary things because you've been like trying to be good and being really restricting things, and really just tapping into your internal resources and thinking really deeply about not only what you're eating, but why you're eating it. And I find intuitive eating incredibly helpful for people who are in a binge and then restrict and then shame cycle. I find intuitive eating to be really useful for people who are on that trajectory. And I also find it really useful for people who have been really unwell and they've lost that intrinsic trust in their body because they feel like their body has let them down and they feel like they can't be trusted. And again, just to really build back in that ability to take on that intrinsic information that all of us have.
Yeah. As you were speaking, I was thinking the way I word intuitive eating, and I have found it a really helpful tool myself in my recovery, and do find it helpful when I've worked with clients as well, is it's about developing sense of safety in your body that you can trust yourself. It's coming back to trusting yourself. So I think so much of the external messaging leads us to look externally for guidance around how we should look and how we should eat and how we should feel and what's right and what's wrong. And it's about getting rid of all of that noise and coming to listening to your own internal kind of compass with that and trusting that, which can feel really scary, especially if food has become something that is scary, it feels unsafe, or especially if your eating disorder or disordered eating is really tied up in trauma as well, because there's a sense of unsafety and distrust in yourself there. I was wondering, as you were speaking, let's say that potentially say there's someone listening who is in a larger body and they've been given this messaging that actually you need to lose weight, you're in this BMI category, your health is causing X, Y, Z, and they're binging. They're in the binge restrict cycle or binge purge cycle. When they want to recover from their eating disorder, they're also being told to lose weight. And these two things can sometimes feel really contradictory. I think a lot of listeners will be in that position. And it's a really horrible position to be in because you feel like you're being pulled in all sorts of directions. They may not have access to a dietitian to be able to work with. So they might be trying to do some of this on their own. So they may not be able to know exactly what their ancestry looks like and how that impacts the health or their risk of developing certain illnesses. What would you say to them in terms of like how they can start to approach this a little bit themselves in a safe way, which is also aligned with health at every size? How could they bring that into their lives?
So I would probably start from a clinical perspective. So I would start with basically getting them to go back to their GP and say, you've told me that I am at risk of such and such. What markers are you using to tell me that I'm at that risk? And if they are, and if it's completely just weight, I would try and have the confidence to say, you know what, actually, at the moment, I'm in recovery from an eating disorder, and it's really important for me mentally not to have that additional pressure. And if there have been some kind of tests done, I would ask, or even if they haven't, I would ask for some relevant biochemical tests to be done. So for example, if someone was told that they were at increased risk of diabetes, I would push back to the doctor and say, have you done my HbA1c? Which is basically a measure of your blood sugar is doing over the course of a few weeks.
I'm glad you clarified that.
Sorry, I realized that I was about to go on without clarifying that. And that would be a way to to have a little bit of additional evidence, a little bit of additional push. And fair enough, if your blood markers were showing that you were at a higher risk of diabetes, then I would ask again to be put forward into kind of a diabetes clinic or something like that, where I could discuss it more thoroughly. But I think if you are suspicious that your healthcare provider is literally just looking at your BMI and then telling you about your risk related to your BMI, it's really hard, but I would try and have the confidence to push back and say, what actual clinical measures are there? And then going on from that, again, it's really difficult when you don't necessarily have access to people who have that kind of health at every size approach, but really trying to explain your situation to whatever healthcare provider you end up going down that road with, to say, you know what, I have this situation, but then I've also got in the background this eating disorder, and I really would like you to take that into account in my care. And yeah, most quality healthcare providers would understand that is a significant priority anyway. And it's really tricky, and it's particularly tricky if you don't have any kind of background in healthcare and you don't necessarily have that confidence to challenge people who are realistically in a position of authority over you. But I think it's just so important to keep asking questions and to keep delving in until that care really feels right for you.
Yeah. I think to add to that, if someone is in that position and they don't feel like their GP or healthcare provider is listening, it's also okay to try a different GP if that's something that's accessible to you. I haven't been in this position in terms of like eating disorder recovery and weight and a health kind of condition there, but I years ago went to the doctors around a health concern that I had and had already taken a lot of courage to build up in me to actually have that conversation. And I remember leaving feeling really dismissed by what the doctor had said. And it was something to do with my menstrual cycle. And the doctor being like, oh yeah, they're supposed to change throughout your lifetime. Oh yeah, no, they're not supposed to be like this. So really dismissive. And then I left it another year because I felt so ashamed of myself for actually thinking that there was something wrong there. And even trusting my own body. I felt I shouldn't have really trusted what I felt was wrong in my body. Took me another year to go back to the GP, went to a different one and a completely different response from the GP. She was like, okay, let's have a look, let's do some tests, and found out that there was some issue there. And I look back at that experience, and even though it's not related to weight or body image here, I think it's relevant because it shows how different providers could lead to a really different outcome based on what you go to. And it frustrates me it's the case because it shouldn't be. Like, I think when someone goes to the doctors to talk about something, there should be more trust in that person in what they're saying, because they live in that body and they might know not exactly what they need in the sense of they're not a medical professional, but they have a better idea of what's going on in their body and maybe the kind of support that they need for that than I think sometimes they're given credit for.
Yeah, no, I absolutely agree with that. And I think when we're thinking about resources that you can draw on to try and support yourself, I think looking even on the internet and on social media for reputable health professionals who work in a way that feels more comfortable for you. Yeah. So for example, if you were looking, if again, we'll use the example of diabetes, if you were looking for kind of information on diabetes in the context of also having an eating disorder, if you were able to search through Instagram or something like that for either a trauma-informed dietitian or a health at every size practicing dietitian who has a speciality in diabetes, a lot of those professionals also provide resources that help you talk to other healthcare professionals. So some people will provide set leaflets and things like that you can read off and be like, I know that it's standard practice, for example, to weigh me. However, I find it very triggering to be weighed and I don't wish to be weighed in this appointment, and have it worded in a way that feels more professional and can help you feel more confident to make whatever point needs to be made to help the professional you're seeing.
What are your thoughts on, so there's Dr. Asher Lamy, the fat doctor. They talk quite a lot online about this challenging weight-centric kind of ways of working with people. And something that I've heard them talk about before is going back to your healthcare provider, your GP, whoever, and saying, okay, what advice would you give to someone, or how would you treat someone who wasn't in a larger body? Do you think that's an effective kind of approach to take? I think you are. You look like you're nodding.
Yeah, so I've never tried asking someone else about it, but I always think about that when I'm in my own practice, because I think anybody, even people who have a really deep-seated belief that health at every size like I do, we still have some anti-fat bias in us, and we still have that kind of societal voice in us. And sometimes I feel myself going down the path of treating people who are in a bigger body differently. And I always try and bring it back to that. I'm always like, look at this individual and think, what would I do differently? Would I do anything differently if they had a BMI of 22? And kind of sense check my own practice using that exact phrase.
Yeah, that's really, I'm trying to think about applying that in like the therapy room, right? As a therapist, and a lot of therapy training is about, can you understand what your unconscious biases are and how do they play out in the therapy room, and how does that impact the way you work with someone? And I was thinking it myself about, if I ask myself, how would I work with this person if they weren't in a larger body, and how effective that is in a therapy context? Because I guess where I'm getting at is there's a little bit of a battle of, yes, I would want to work with someone. I wouldn't want to work with someone who's in a larger body in a way that would be like pathologizing them being in a larger body. Not at all. But equally, there's something about working with someone therapeutically that's important to acknowledge that if they are in a larger body, we need to acknowledge what that lived experience is like too, to not dismiss maybe what, I guess that's a trauma-informed way of like, what have they experienced? What biases do they come across day to day, and how's that impacted their relationship with themselves and relationship with food? So yeah, I don't really know what my point was there. I just thought that was like, I was trying to apply it to the therapy room.
Yeah, no, absolutely. Because I hear what you're saying as well, that you don't want to sideline that experience, because if you're in a bigger body, do have a really different experience of the world. I suppose my point of that is in a very clinical context of looking at a particular measure and thinking, how can I treat this? And would I treat it differently if someone was in a different body size? But definitely, if I'm more in the kind of person-centered psychological
world,
then absolutely, you have to acknowledge the fact that, like myself, I have extreme body privilege, that I have never been in a larger body, and I have never experienced what it is like to be in a larger body. And I absolutely do not take that for granted, and do not take it lightly that, people have really different and often very difficult experiences existing in the world, and certainly existing in a healthcare environment as well.
Yeah. And I think if there's anyone listening who is wanting to work with a dietitian or therapist, that actually it's really important to find a therapist that does acknowledge that. You may feel comfortable if you're in a larger body working with a dietitian or a therapist who is in a larger body as well, so that they have perhaps a more lived understanding of your experiences. You may not, and that's totally fine. That's down to personal preference. But I do think if you're going to work with someone who is in a straight size body, then it's really important that they have that understanding of the difference between you, and can acknowledge that difference in a way that feels respectful, and it doesn't impact the therapeutic work or psychological work that you're doing with someone negatively. Yeah.
Yeah. And I often do reflect on how the messages I give about health at every size are portrayed because of the body that I am in. I am a kind of, a straight sized white woman. Like, there's very few more privileged positions to be in than that when it comes to being taken seriously. And I do worry that kind of my messages might be diluted a little bit by the fact that I haven't ever had personal experience of that. But then likewise, I wonder what the reaction to how I practice and the messages that I give would be if I was in a larger body. Would I be more quickly dismissed as them saying, that's just wishful thinking, isn't it? From that girl who just wants to be healthy even though she's overweight. It's like, I reflect on that a lot.
Yeah. It's almost, I guess you're saying, if you were in a larger body, you feel like you might not be taken quite as seriously in the work that you do, sort of from a professional point of view. And that's wrong. That's really wrong. But I suppose there's an element of okay, if I am taken more seriously, how can I use that to try and help other people and also elevate voices of other people who may be in larger bodies and are not taken quite as seriously, so they don't get dismissed either. It's that balance, isn't it? You don't want to take up space from other people in that field, but you want to work with them.
Right. And I think dietitians can be really intimidating because of that sometimes, because we unfortunately are primarily size 10 white women. That's the really generic impression of dietitians. And I know that a lot of my colleagues who do not fit into that mold find it a lot more difficult to practice as a dietitian, and some kind of my broader nutrition colleagues worry about progressing their career from a nutritionist to getting registered as a dietitian because they worry that their bodies are going to hold them back in that profession. And I just find I find that really challenging, because it's, how can we possibly do the best for the people who we're working with if we're not even really in a position yet to fully advocate for ourselves, if we're not in that kind of really societally sanctioned body.
Yeah. If you do have any colleagues who are in a larger body and would like to be on the podcast, let me know, because it would be great to have another perspective as well, another lived experience for people to relate to. Absolutely. Just, I guess, one more question that came up for me as you were speaking about supporting people through health, from a health at every size perspective. They may have concerns about gaining weight and what that would have on their health, I think is a big block for people in recovery. What would you say? I guess I'm wondering, there's this, I often think about like the rebel, right? We can all have an inner rebel in us. And I think sometimes the binging part of us can be that rebel coming out, because we've got the food rules that is telling us all to do X, Y, Z and be quote unquote good. And then the rebel comes in and is like, no, I'm not going to do that. How would you approach it if you're working with someone and they want to focus on health and you're trying to work on health promoting behaviors rather than health equates to weight and weight loss? But the idea of any kind of nutritional guidance, so the idea of kind of, oh, I'll eat this because it's good for my health, anything like that feels like a rule. It feels like it triggers this eating disorder part of you that's, no, I don't want that. That's a rule. Have you experienced that with people? And if so, like, how do you navigate that with someone?
Yeah, absolutely. No, I've definitely experienced that. So I think the first step when you are in eating disorder recovery is to really become comfortable with eating all different types of food, eating all different types of amounts of food. And that's step one. And when you feel quite comfortable in that, like you say, it can be really difficult to then reintroduce that structure again. And one of the key tenets of intuitive eating is reintroducing gentle nutrition. And gentle nutrition thinks much more broadly about the pattern of eating in your life rather than the individual foods that you are having. So goals that you would want to achieve from a gentle nutrition perspective would be things like increasing the variety of fruit and veg across the week, increasing the variety of different types of complex carbohydrates that I have. And a lot of it is more about adding things in than taking things away. And I think that's really important, because if you start to restrict again, you are going to get back into that binge, restrict, shame cycle, because that's naturally how our rebel minds, as you put it, respond to restriction. And I think what is much more important is introducing those healthy habits. So I think for your average person with an average health and no really specific health concerns, what you would be looking for is a healthy, balanced Mediterranean style diet, which has plenty of high quality protein in it. It has lots of different types of fruits and veg in it. It has lots of different types of complex carbohydrates, lots of nuts and seeds and beans and lentils, and lots of really beautiful health promoting foods. And my interventions with people are all about adding those things in and not even thinking about taking out anything else. And I think that can be a really nice way to approach it, because you're not upsetting that rebel. That rebel can have whatever they want to have. But when you're doing your shop, when you're planning the meals that you want, you are adding in extras and building that overall dietary pattern.
Yeah. It was like zooming out a bit on health. And this can be where our mind goes when we're in disordered eating or just eating disorder. We get really focused on the details of what we ate. So that meal, or did we eat too much, or have we binged, and what does that mean about it? We can really zoom in on all of those details. And it's like zooming out and going, what does my diet look like over the last month, over the last 6 months, over the last year? And how does that impact health, rather than this one meal that I've had now? And even like when you say about ideally introducing sort of a Mediterranean style diet, I feel like as well, zooming out there into kind of all this Mediterranean style diet is great. And that's really health promoting from a physical health perspective. And equally, there's also the fun food, what I call fun food. So it's like that might nourish your health from a social perspective or an emotional perspective, that having foods that are more highly palatable or more calorie dense, that they're also part of health if we zoom out onto the bigger picture of health. Because if we didn't have them, we might miss out on social connection. We might miss out on that pleasure and all of that. Whereas I think, again, in eating disorder, when you're in the eating disorder mentality, health can be just based on the food that you eat. And it's actually much bigger than that, isn't it?
Yeah, absolutely. No, I completely hear what you're saying. And again, that's why I really want to focus on adding things in rather than taking things away, because I would never want to take away people's celebratory foods, people's joy foods, people's culturally important, all of that. Because food, yeah, is so much more than nutrition. It is the way people express their love, their happiness, their sadness, all of these different emotions. And yet again, in that kind of societal norm, food shouldn't equate to emotion. It's just calories in, calories out, isn't it? But it's not. It's so, we all know it's so much more than that. It's so important.
Yeah. And food is, I think, that idea that food is not emotional is, even if you go back to way back to being like tiny, food is emotional, because you associate feeding, whether that's breastfeeding or even bottle feeding, with that connection, that emotional attunement and connection and bonding. So even from being so young, before we get all of this diet culture messaging and we become stressed and we use food to cope with the stress, food is still emotional. It always has an emotional aspect. And I think we can't deny that. We need to work with people. It is emotional. How do we work with that in a way that feels sustainable and it's not shame inducing? And there's other coping strategies, and there's also health in there.
Yeah. And I think that's why that gentle nutrition tenet of intuitive eating is basically just one of 10 steps. So that's right at the very end. Once hopefully you're in a more peaceful place with food, once you're in a more peaceful place with your body, to then start adding in the things that are going to have that physical impact on you, rather than just the mental aspect, because it's got to be a combination. And again, like I was saying about the two-tiered approach of dietetics, it's the kind of evidence-based, research-based, clinical-based, physical aspect of it, and then all that really person-centered approach that you need to actually make these interventions worthwhile for the person and actually improve their life with them, rather than making things harder.
Yeah. Thank you, Alice. I feel like you tied everything up really neatly there by bringing it back to the two-tiered system. It felt like a really good place to to end today, unless there's anything else that you really had a burning desire to share on the episode.
No, absolutely. I think that, that's something that I really live by and really practice by, is that, you have your food for health and for body and for physical functionality, but you also have your food for all the other amazing things in life, for all of the emotional factors, for all of the family factors, for all those things that I think both are equally important.
Thank you for coming on the podcast today. I will put Alice's kind of links to her socials and everything in the show notes, like the description underneath. So if anyone does want to connect with Alice, you can do. Equally, if you've got any questions that you want to ask me or Alice around this, then please just drop us a comment. We'll get back to you. I always love it when people do reach out, because it's just really nice to connect with the people who are listening and to hear your experiences as well. So thank you for listening, and thank you, Alice, for being here.
You're very welcome. And I would say, as a caution to people, I'm not particularly active on social media, so there's not a huge amount of new content on there. However, I am, like Becca said, I am always really happy for people to reach out to me with specific questions. And I also do free introductory sessions with people to figure out what they might need from a kind of dietary health perspective, and whether that be to go on and work with me, or whether that be to go in a completely different direction. So always very happy to hear from anybody.
Thanks for sharing that, Alice. And thanks for listening, everyone. And I will catch you all on the next one.